Doctors of Reddit, what is the most unethical thing you have done or you have heard of a fellow doctor doing involving a patient? I once knew an OB who didn't like to work after about 5 p.m. So at the end of office hours, if they had someone in labor, they would swing by labor and delivery and find a reason to do a C-section on them. Sometimes they blamed the baby's heart rate tracing, justified or not. But the classic one would be that they would check the patient's cervix and lie about how dilated it was, so it seemed as if labor wasn't progressing rapidly enough, and say, I just don't think this is going to work, cut her, and be home for dinner. Now in OB, we love TLA's 3-letter acronyms, and one of the real indications for cesarean is CPD, cephalopelvic disproportion, which is where the baby's head is too big for the pelvis. But for this particular doc, we always said that they cut patients for CPD, cesarean prior to dinner. Edit. No, I didn't report this doc because it's not possible to report someone for a subjective judgment call. As for this doc not being allowed to practice anymore, a hospital can't revoke privileges for being a shitty doc even if they want to. The law is written in such a way that the hospital would easily be sued for restraint of trade. I don't like it either, but unless laws get changed, that's what we're stuck with. You know, I've heard of this, but somehow this made it real, and now I'm scared. I remember this. He said he needed a symbol on it to help him know the orientation of it, and he just so happened to use that. He was removing the uterus anyways, so I don't see the issue. Probably just UFL fans. That fact really changes things. They could be fans of a rival college, but only complete idiots would care about that. I work in a pharmacy, and a doctor was just recently blacklisted from our pharmacy because he was prescribing his attractive female patients high doses of opioids to get them addicted. Then he would only refill their script if they had sex with him. Apparently, he was doing it for years before anyone said anything. Edit. This is a couple links to the story for everyone who thought I made it up. Since being blacklisted, he has also been arrested and charged with 13 felonies. I would honestly expect no less than jail time for something like that. My friend's dad was recently in jail for something similar. He was a psychiatrist and would give attractive women, who didn't need it, Xanax prescriptions in exchange for sexual favors / pics and cash. When he was caught, his wife, my friend's mom, committed suicide. I just can't imagine how, as a professional psychiatrist, you can do something that unethical. Psychiatrists can be twisted people in addition to being in charge of medicating other twisted people. I once had a psychiatrist tell me, get a gun, when I asked him what I should do to help alleviate depression. To this day, I wish I would have reported that comment to someone. I also wish I hadn't been so completely speechless. I should have asked if I could get a prescription. Not unethical exactly, but frowned upon by the hospital if they found out. While I was a junior doctor, I had an elderly patient on our specialist cardiology ward who'd had to travel 100 miles for a really specialist treatment. She didn't have any family, and all her friends were similarly elderly and couldn't drive far, let alone a 200-mile round trip to visit her. She confided in me that she was running out of clean night dresses and was embarrassed that she didn't know what to do. So I took them home and washed them for her in my machine. Looking back, I'm sure there was some procedure I should have followed. We're not supposed to get personally involved, but she was so sweet, and it was late, and all the admin people had gone home. Edit. Oh my goodness, thank you for the gold. I know we're not supposed to say it, but thank you anyway. Also, I'm sorry if this looked like karma whoring. I can see in retrospect how it looks that way. It was honestly just the first thing that came to me, maybe because all my colleagues were so horrified at me when they found out. I've never been good at boundaries. I once took an aspirin for myself, was nearly arrested. Oh goodness, yes. Similar experience with paracetamol. And drinking tea at my desk. 12-hour shift, no break. Stack of paperwork to do. Billing clerk here. At my doc's office anyway, we bend over backwards to help people who simply communicate with us. If someone calls and says they are struggling, we take payments of $5 a month with no interest and let people skip months if they just call and ask, and sometimes we just write balances off altogether. It's a private practice, though, so we can get away with that. Wish all medicine was like this and not huge group practices. From a patient perspective, I still have trouble with this one. I was getting a severe wound on my shin cleaned of debris with a scrub brush. The doctor, for some reason, wasn't wearing any face protection and managed to splash wound juice in her mouth. Her response was a PFFBE, PLBBFD, PBFFFTT. I got your juices in my mouth. Patient was stabbed, blood in chest cavity pushing on heart, patient unconscious. Doctor drains cavity, explodes all over his face, plus in eyes and nose. Patient all better now that heart can beat freely. Doctor proudly takes shower in plus good mood. Comes later to check on patient. I was stabbed by my boyfriend because he found out I have AIDS. That can't be real. So we do the proper prevention. A doctor would never take a shower and just chill after receiving a blood explosion on the face. That makes no sense. I'm using a throwaway for this. This happened a few years ago and began when I was a third-year medical student during my general surgery clerkship. Just to get my bias out of the way. I should say, I really did not like the surgeons charged with running the clerkship. I thought they were incredibly unprofessional, egocentric pricks who only cared about how much a student would kiss their ass. And this went far beyond the stereotype of the typical surgeon. I shadowed surgeons in high school and college, and always wanted to be one. But this department was dysfunctional on a level I had never encountered before or since. I could write a book of the insanity I witnessed there. So anyway, this particular incident starts about a month into the clerkship. By now, us med students had settled into our roles there, learn the daily ins and outs, get there around 5:30 a.m., have morning conference and rounds, spend the remainder of the day in the or in clinic hours, and get done anywhere between 4 to 6 p.m. on a good day. Once or twice a week, we would also do call, where after the regular hours it concluded, we would report to the ER and work there till around 11 midnight. So as per usual, I get through the day and arrive at the ER around the usual time. When I get there, the attending covering the ER greets me and gives me a rundown of the patients currently there. Most of them are the usual bullshit type stuff we see at the ER, abscesses, a laceration that needs stitches, nothing serious. But he says they have an interesting patient that was just brought in, a woman in her early 70s was just brought in by an ambulance. Or actually a second ambulance. She had gone to her GP complaining of dizziness, and the GP sent her on to the hospital. The GP was concerned about her driving in her state, so they called an ambulance to drive her to the hospital. On the way to the hospital, the ambulance got into a car accident and flipped on its side. So the woman was then picked up by a second ambulance and brought to the hospital. Now, in addition to getting a workup for the dizziness, there was concern of internal injuries stemming from the car accident. So she gets a CT and afterwards gets parked in the urgent room of the ER. Serious car accidents. The room has a couple of dedicated nurses, whereas the other 3 surgical ER bays share a group of nurses. The patient is hooked up to every monitor and then some, but she is awake and seemingly in good spirits. I apologize for the detail here, but I want to paint a vivid picture of just how incredibly fucked up what happened really was. So at this point, I go over and introduce myself, let her know I'm the student doctor on the floor for the evening, and if she needs anything, my name is for doctor, and to just ask. The attending reviews the CT and report, as does the resident, and things seem to be fine. The night goes on. I follow around the resident doing the shit work for the night, mainly cleaning up after he drained a couple of anorectal abscesses. Like clockwork, every time it was my night in the ER, it was as if the moon and stars aligned to obstruct the anal sinuses of many a citizen and send them to my doorstep, but that is not part of this story. Okay, so I get through the night, periodically checking up on Mrs. X in between my other tasks. And at around 11 p.m., the attending says it's pretty slow, so I can call a night. I say goodbye to the staff, say good night to Mrs. X, and that I will see her in the morning. So I go home, crash, get up the next day, and head in around 5:30 for the regular morning meeting that comes before rounds. When I arrive, I could immediately sense that something was off in the room. Everyone was visibly on edge and quiet, not even whispering among themselves. They were waiting for the department head to arrive and kick off the meeting. So the department head arrives, and he looks very unhappy. You should note that this mini always looks unhappy. He was a German Jewish fellow in his late 60s, and he was tough as nails. Always serious. Never a smile, never a compliment. You know, in those World War II movies where they portray the Nazi villain as just some caricature of stern seriousness that is incapable of emotion? That was this man. Some of the residents even had a couple of Nazi-inspired nicknames for him, which, me being Jewish, I found incredibly funny. But again, not the point. Gotta focus and not go on any more tangents. He walked into the room without saying a word and sits at the head of the table. There are now 30-plus people in the room, mostly attending physicians, residents, and med students. About 30 seconds passes without him saying a word, and then he just lets loose. In the span of a few seconds, it was just a torrent of hate and vitriol pouring out of his mouth. His face turned so bright red, I thought it was going to ignite his hair. And he was talking really fast and was so angry it took a couple of moments to piece together exactly what happened. At around 1 to 2 in the morning, Mrs. X started having trouble staying conscious. She was rushed to the ICU, and at the time of the meeting, she was in a coma with a very low likelihood of recovering. Apparently, the radiologist, attending, and resident all missed what was allegedly, at the time I was not particularly skilled at reading CTs, a very obvious lacerated spleen. And to make matters much worse, the resident on call wrote in her chart ordering 24-hour observation. To the uninitiated, that may seem normal or at the very least not problematic. However, in this setting, when you want someone observed, you need to give clear instructions on exactly what you want observed and at one-time intervals. Writing to have the urine output checked every 15 minutes, or blood pressure, or oxygen saturation, or any number of other parameters to assess the status of the patient. These things need to be very clearly enumerated to ensure the patient doesn't get overlooked. And unfortunately, that is what happened to Mrs. X in this case. Without instructions for what to do, the medical staff, attending, resident, nurses, all just sort of passed by her assuming that someone else was on it, or assuming that since there were not clear instructions, everything was all right. So the verbal ass-reaming continued for what felt like hours. The resident that wrote 24-hour observation got told several times by the department head that she would be thrown out of the program during a scream session. And this was in front of the entire department staff. The attending on call got it just as bad, if not worse. Unprofessional, lazy, not worthy of being a doctor. Pretty much anything you can imagine. During his tongue lashing, it was implied he should start sending out resumes to other hospitals. Finally, her doctor decides to end his scream session by rhetorically asking the doctors involved what they planned to tell the family of Mrs. X, to which they all sat silently. After a moment of awkward silence, everyone starts to shuffle out of the room and continue on with their day. So now fast forward a couple of months. At this point, I have finished my surgical clerkship and a couple of clerkships that followed it. Now I'm rotating through a family medicine clinic in the suburbs about a half hour from the hospital. And on this particular day, we get an elderly gentleman coming in complaining of a cough or a cold. I can't quite remember what his original complaint was. Anyway, the doctor I'm working under, let's call him Mike, says that this patient, Mr. X, is an interesting story. Dr. Mike says that a couple months earlier, Mr. X's wife came in complaining of dizziness, and he sent her to the hospital to get a more thorough workup. Mr. X then tells me what happened to his wife. As he was told by her doctors at the hospital, a surgeon from the department I clerked at, that on her way to the hospital, the first ambulance ran a red light. And in the ensuing accident, she suffered an internal injury. After she passed, they told him that there was nothing they did, everything they could, and that she ultimately succumbed to her injuries. When he was telling me this, he was getting a bit irate, because he said when he was with her late that night in the ER, this would be prior to being rushed to the ICU. He had been trying to get the attention of a doctor or nurse to no avail for a couple home. URS because he thought she was worsening. Continued from previous post. So, with little recourse left and being told that it was the ambulance drivers at fault, he was currently pursuing legal action against them. I remember him telling me his story so vividly because I was so overcome with anger during the whole thing. First, being reminded of such a stupid fuck-up by so many people that ultimately led to Mrs. X's untimely death, and then infinitely more angry when it became clear how much he had been lied to or intentionally misled concerning his wife. And I vividly remember how not at all conflicted I felt when I told him everything I knew about the situation regarding his wife. That I was on call when she arrived to the ER, that I spoke with her throughout the early evening, that multiple doctors missed the lacerated spleen in her imaging, about the resident's fuck-up in the chart that escaped notice of the attending and led to his wife being basically ignored until she was comatose, and about the conference the following morning where it was clear that everyone in the department knew what ultimately caused Mrs. X to die, and that he was clearly being lied to by whomever he spoke with. I remember the look on Dr. Mike's face, almost a look of shock and happiness. Dr. Mike and I had really hit it off from the start of my family medicine rotation. Even though I didn't go into family med, I really loved the community work. Also, Dr. Mike and I had very similar philosophies about medicine and life in general, so we got along really well. And I could see he was happy that I decided to speak up and tell the truth about what happened, instead of just keeping quiet to protect a fellow doctor. It was at that point, of course, that I remembered, shit, I'm still a third-year medical student. And I just outed what could be at the minimum a serious lawsuit, and at worst a scandal at the primary hospital of the medical school I attend. And I could face very serious retaliation over this. I don't want you to think I'm exaggerating. There was a fellow student who admittedly was a real asshole that no one liked, that spoke up about some shady stuff the administration was doing a year earlier, and he got expelled from the program over it. Fortunately for me, Mr. X was extremely mindful of my situation, and he and Dr. Mike told me that they would keep my name out of anything that happened going forward. To this day, I still keep in touch with Dr. Mike periodically to see how things are going. Last I had heard about Mr. X was a couple years ago. He had his lawyer go after the doctors responsible and the Department of Surgery. Knowing this was a case of egregious medical error, the hospital offered to settle, and because they were now aware that the doctors actually lied to them and tried to cover up their error, Mr. X got a settlement almost an order of magnitude larger than he would have had it been just an egregious error, minus the line. I know, of course, that this does not make up for Mrs. X. And frankly, I wish he hadn't settled, but taken them to court and try to have the medical licenses of all those involved stripped, but Mr. X did what he needed to do for him and his family to move on from their tragedy. I'm only glad I could play a part in making sure those scumbags that give my profession a bad name paid for their callous disregard of their moral, ethical, and legal obligations. And that is my story of the most unethical thing I have ever seen another doctor do involving a patient. Funny D, I may have given the incorrect impression that it was the initial missing of the diagnosis or the chart error that had made me angry. Mistakes are unfortunate and do happen in the profession. I have made mistakes in my career. It was the handling of the mistake after the fact by outright lying to the patient's family that I found upsetting. I briefly worked at the front desk clerk for an ER at a local hospital. The rule was that anyone that came in complaining of chest pains had to be back and on a machine within 10 minutes of arrival. Once I entered their name into the system, a clock started. So I was told not to enter their name until they had already been taken back to essentially make our numbers look better and make it appear as though they were receiving care within the prescribed 10 minutes. Edit: people complaining of chest pains were typically brought back quickly, just not always within the 10-minute guideline, although generally faster than anyone else. This mostly seemed to be just about producing better stats, although keeping it off the system gave them the ability to delay. There are three kind of lies in the world: lies, damned lies, and statistics. My opinion: never trust an individual stat. They're almost always manipulated, and if you have chest pains, take aspirin. Did the same kind of thing when I used to work at Burger King. When it was slow, I'd get in my car, order a water, then drive around, and do it over and over again, so our times would look better. But yeah, this is different. Just so you know, us number crunchers up at corporate can often tell when you're doing this. Luckily for you, we can also choose to exclude that data from the crayon and finger paint PowerPoints we have to spoon-feed the VPs. I'm a physician and used to work 12-hour night shifts at this hospital in California. My coworker, who is also a doctor and admittedly a young and good-looking fellow, and I covered pages from different floors. If there was nothing going on, I would usually be in my call room reading/sleeping/watching TV until a nurse would page me for a problem. My colleagues on call room shared the same wall with mine. One night, I was reading in my room when I started hearing my colleague and another woman having sex. The noises started getting louder and fairly difficult to ignore. Sorry, but she was pretty loud. Then, in the middle of this charade, I heard his pager go off several times without him answering it. Eventually, I left the room and called the hospital operator. I asked her who had paged Doctor, my colleague's name, and then called the nurse who was trying to get in touch with him. Turns out, the page was for a patient that was in a serious condition and had to be taken to the ICU. I took care of everything and went back to my room. Later on, I told him that they were paging him for a critically ill patient overhead and that he must have fallen asleep. I didn't say anything about hearing his Allegro Chamber Sex Orchestra, but I think he knew that I knew because he got red and thanked me for covering for him. I assure you that this did happen. This sort of activity among younger physicians and residents is not uncommon. Chances are, many of the writers of your favorite TV shows draw inspiration from actual events. I wouldn't be surprised if another physician had a very similar experience to mine. My best friend's mother, Rula, is from Lebanon. When Rula was a young girl, she got pretty badly injured and went to the hospital. The doctor then proceeded to tell Rula's mother that she had passed away due to the injuries. She did not believe her and soon discovered Rula locked in a closet, waiting to presumably be sold into slavery. It was in the news here, but there was a surgeon in Birmingham, I think, who diathermed, essentially burnt, his initials on a patient's livers. My colleague worked with him and saw him do this. I personally haven't seen much that's too bad. There are a lot of pretty dark jokes in the doctor's office, but nothing potentially damaging. A nurse did once offer to give me unprescribed flucloxacillin for a skin infection, but I politely refused. Not a doctor, but a cousin of a bandmate came to a festival with us and proceeded to drink 2 bottles of whiskey, neat, jump over campfires with an axe, kick over a pushchair with a baby inside, and fall on top of it, and have a blazing row with the mother before passing out halfway into his tent. We were woken up by security asking if we knew him and what time he would be awake so they could kick him out. Following an extended period of guard duty, he was woken and evicted, at which point he decided to drive home to get ready for work as a doctor the next day. Edit, it seems children at festivals is a subject people feel passionate about. For the record, it was a relatively family-oriented festival read. New Age hippie, UK, but I also have major concerns about the number of unsupervised children at the festivals I've been to, and the level of fucked their responsible adults are. Festivals can be an amazing experience for children and families, but picking the appropriate festival and being a good parent, i.e., not getting fucked, making sure your child is safe and having fun, is important. Everyone hates those people. The young parents who bring their toddler to a house party and let it run around until it falls asleep on the bed with all the coats on it. And they're like, what are we supposed to stop going to things because we're parents now? And everyone avoids eye contact because we were going to get high in that coat room. My grandfather was a physician in a small town and also worked as the pharmacist, as this was how it was done in rural areas. He lost his medical license for trading medication for sexual services from patients. He was a brilliant doctor and graduated top of his class from Dalhousie, but was a weirdo. When I was younger, he was also arrested for smuggling drugs into Canada. This happened when I was a medical student working in the ER. This 20-something male was drunk driving and crashed his car into an elderly couple, causing them to require emergent surgery. He was belligerent and walking around naked in the trauma bay. Nurses were trying to get him to calm down and stay in his room and stop yelling. He was calling the nurses bitches and asking to go to the bathroom, so they gave him a urinal. As he was urinating, my attending went up to him and said, "I want you on that bed right now." He said, "Fuck you," so my attending knocked the urinal out of his hand. Piece went flying all over the room. He picked him up and threw him on the bed and pushed some rocuronium through his fore to paralyze him. Then he seemed to take his time with intubating him, letting his O2 sat get down into the 40s before finally letting him breath again. I don't know what ended up happening to the guy in the long run. Turns out he had just broken up with his girlfriend and went on a drinking binge. He deserved to be punished for what he did, but I don't think he deserved to be forcibly intubated for no reason other than causing a scene. I've broken up with a few girlfriends. Usually, I quietly sit at home and consume nothing but wine and pizza for a week. 2, if I really loved her. At no point did I get shithoused and put 2 senior citizens in the hospital and then cuss at the medical professionals trying to attend to me. Docs in Pakistan do this, I heard from friend. 1, do C-section surgery to create higher bill. 2, while fixing bone, steal a kidney to sell it off. You don't even know. 3, do tonsil surgery for no reason. For if getting late and some veins getting in the way of surgery, then cut it without knowing what is it off and resulting in death. 5, doing surgery without anesthesia because drug is not available hospital admin, took money home instead of buying supplies. 6, abducting newborn and saying died during birth. 7, giving expired medicines. 8, prescribing unneeded medicines because they're given commission by international pharmaceutical companies. 9, making patient visit 3 or 4 times by not treating fully. 10, abandoning patient because 8-hour shift is over. 11, receiving salary in government hospital and only show up a couple of times a year while bribing admin and run their own clinic. But $2,000 bill for 4-minute visit still is more outrageous to me here in NYC. I would rather pay a bit more than to lose a kidney because a doctor is a little greedy. My mom is a nurse that worked at a hospice. She was known among the other nurses as having a gift. When it was coming time for a patient to reach his or her end, my mom would be able to guess the time of death, usually within 5 to 10 minutes. The nurses would make betting pools and really were fascinated by what my mom could do. They would tip her off on a patient in bad condition, and she would go in and take their temperature, feel the feet, and check their pulse and walk out with an exact time. She won a lot of money and free lunches in her stay there. When a higher management official approached her one day about it, she immediately started to apologize for her unprofessionalism. The manager stopped her and told her she was in fact impressed by her ability. My father is a psychiatric nurse, and he will openly say how jaded he is by the incompetent people he works with. He has been employed as a registered nurse since the 1970s. But in recent decades, the government has slashed the mental health budget. So instead of hiring qualified nurses who command a higher wage, they hire what are essentially babysitters with no experience. His patients are seriously mentally disabled. Not the type who need to be put in a straitjacket and sedated, but grown men with the intelligence of 4-year-olds. These babysitters know nothing about restraining them when they get violent. They just cower in the corner and wait for the 1 or 2 nurses in the building. There's also a lot to be said about the character of these babysitters. My dad told me about one patient who had a phobia of cicadas, so this arsehole colleague thought it would be funny to catch a cicada and chase the poor patient around the ground with it. The worst case of incompetence he told me about happened at this hospital that was located within walking distance from a major 6-lane motorway. 2 nurses came in for their night shift. Patients are sleeping, so workers on the night shift will watch TV or do anything else to keep themselves awake during quiet periods. These guys had brought in computer equipment with the intention of repairing or building a computer, I don't know. The fact was that they were so engrossed in their task that they failed to notice one patient who had woken up and left the premises. It wasn't until emergency services showed up and told them that there had been a fatal accident on the motorway that killed this patient that these nurses realized anything was amiss. Neither of them got sacked thanks to the strength of the nurses' union. That is genuinely horrible. C-sections increase the risk for all kinds of diseases, and they're subjecting these kids to that so that they don't have to be late for dinner. I get it that being a doctor is hard and long hours, but candidly, that's part of the gig. From the abstract, results. Children delivered by cesarean delivery had significantly increased risk of asthma, systemic connective tissue disorders, juvenile arthritis, inflammatory bowel disease, immune deficiencies, and leukemia. No associations were found between cesarean delivery and type 1 diabetes, psoriasis, or celiac disease. Edit. It does mean that this should factor in more than being late for dinner. Edit 2. Since there seems to be interest in this topic, there is an NIH study putting forth an actual hypothesis that exposure, or lack thereof, to vaginal microflora does impact immunity development.